top findings from Aon's 2016 Healthcare Survey. If you have a question while we're presenting today, you can go ahead and enter that in the question box. You'll also see contact information at the end of the presentation. So again, thank you. Brian, I'll hand it over to you.
Great, thanks, Monique. Hi, this is Brian Steidel. I'm a Senior Vice President in Aon's heavy industry practice, focusing on clients with risks in that space. And I'm joined here today by Mitch Santiago, a senior consultant from Aon's health and benefit practice. Annually, Aon conducts a survey of nearly 1,000 healthcare and benefits managers. And the survey is a robust survey with well over 100 questions. And it focuses on trying to identify attitudes and trends on plans and core strategies for health and benefit programs. So the purpose of our webinar today is to update folks on the key results of the last survey and answer any questions that folks may have with regards to the results of the survey. So with that, I'll turn it over to Mitch, and he'll walk through the presentation. We certainly encourage folks to ask questions as well.
Great, thanks, Brian. And again, as Brian said, feel free to send your questions through the chat. We're happy to respond to them. We may wait till the end of the presentation, but we'll get to your questions. Brian mentioned that this is our annual survey. What I did in this document is I pulled our manufacturing cuts. So what we're going to talk about today are national findings, and then I flagged the responses from our that have been consolidated from the manufacturing sector. So I flagged those, I've noted those in the document. We'll talk about that as we go forward. Before we get into the findings, one thing that I did want to mention, and here's the commercial, so buckle up. At Aon, we believe that good benefits are good for business. And when we think about how we work with our employers, some of the things that we like to do are really starting in with well-being. And you'll find that throughout the presentation, that these 5 themes that we work on with our clients, they're really driven through the findings that we're getting from the survey findings. But we really think that employers should start in with well-being. We think that employers need to change the way that you pay, and by pay we mean paying health systems and providers, because they're changing the way that they deliver health care. We think that our clients should hold people accountable, but fully support them. I think historically we've done a really good job of holding them accountable. Supporting them is getting better, and we'll talk about that in the survey findings. Requiring the right care, making sure that people are going to the right places at the right time. That's an emerging trend that we're seeing in the survey, and something that you're going to find is something that's coming in the future. And then managing the most complex cases. These are the people who are driving your higher costs. Again, these are things that employers are really going to be focusing on in the coming years. So with that, why don't we start walking through the survey results and tell you what you and your peers are telling us. In 2015 and 2016, and as you were seeing, generally what you told us was that you were seeing mid to low single-digit increases. So in that 5 to 8% range is what we saw for healthcare cost increases, and that was consistent with what we saw with our clients. And it's pretty consistent with what we're seeing for the work that we're doing for our clients for next year. As we're beginning to prepare for the 2017 renewals, our actuaries are saying that most clients are going to experience somewhere between that 5 to 8% increase. A lot of that's going to be driven by pharmacy, and not necessarily traditional pharmacy, but specialty pharmacy trends. So I'm sure that many of you may be noticing these large claims coming through in pharmacy spend. That's being driven by specialty, and it's something that our clients are very concerned about as they try to manage their healthcare costs. Another thing that we found in our survey was that 65% of employers and about 64% of manufacturing employers have developed a formal healthcare strategy. laid out a plan of how they're going to manage their healthcare costs. And we asked employers, what are the things that are influencing your healthcare strategy? Well, not surprisingly, what we're finding is that healthcare costs, what's happened in the past, and healthcare trend, projections, what's going to happen in the future, that's a lot of what's driving strategic decisions. But employers also told us that the business strategy, business objectives, were another important thing that has been driving their healthcare strategy. Think about that. We're going to come back to that as we go through some of the findings. The other thing that's of interest, at least to us, are two other things. One, the manufacturing sector. You'll see that they, in addition to those three things that we talked about, they also pointed out that complying with healthcare reform laws was another big driver in creating their healthcare strategy. One thing that we didn't see a lot of, it's highlighted down there, is employee feedback. And getting employee perspectives on what they're looking for from healthcare. We're not seeing a lot of employers trying to get employee feedback. Again, as we start to go through the survey and think about challenges that employers are having in executing on their survey, we're going to tie back to this not having employee feedback in developing programs.
Mitch, could that create a bit of a disconnect or some concern on the part of employees, because the plan design may not meet their needs if they don't have the option, don't have the ability to provide that feedback?
That's a great point. I mean, what we're seeing in a lot of our research is that employees don't understand the programs that are being offered. They don't appreciate it, and they don't understand what they're supposed to be doing. So a lot of employers have set these strategies but not communicated the purpose behind them, or gotten employee feedback on what ought to go into the strategy. So we are seeing this disconnect, and what you'll find sometimes is employers not really achieving all the results they anticipated because they didn't have the input from the employees on what they were looking for out of their healthcare program, and the employees don't understand that.
So it may not be the design; it could be the execution or the rollout of the plan that's resulting in not getting the outcomes expected.
Exactly. And that's a great segue because, when we asked about outcomes that employers are looking for in managing the healthcare strategy, things that we're seeing are, we want to meet our budget. We want to, contain our costs, but we also want to increase employee engagement in health and well-being programs. We're offering all these health and well-being programs. We're not getting the engagement. Let's think back to that last discussion, Brian. If employees don't understand it, weren't engaged, or gave feedback, how are they going to get engaged in these programs? The other thing that manufacturing employers told us was that, it is, one of our outcomes is managing at or below market average trends. So not just being at that mid to low single digit trend, but trying to beat that. And really trying to be below that is one of our outcomes of trying to deliver care. One thing that is interesting, we mentioned on the prior slide that employers are really trying to tie their business strategy and business results to the healthcare strategy. But if you look at the bottom of the slide and you look at, understanding how poor health affects, employee work performance, it's not something that employers are thinking about when they're trying to achieve outcomes. So just noticing some disconnects between what employers are telling us their strategy is, but what they're really trying to achieve with the strategies.
Mitch, when you say kind of health and benefit programs, what exactly do you mean by that?
It's a good question because it encompasses a lot of things. When we're talking about health and wellness programs and well-being programs, we're talking about health risk assessments, biometric screenings. Think about coaching programs that we may offer to employees. We're finding that a lot of employers, and I have a client that's one of your members, and they offer a lot of programs and they're doing a lot of things, but they're not getting employees engaged in these things. That's where we're really trying to take a step back and really helping our clients understand you're paying a lot of money for these programs like transparency tools and screenings and assessments, how do we get the best bang out of the buck that you're spending. We asked employers, what are the challenges that you anticipate or expect when you're trying to execute on your strategy? Not surprisingly, two of the biggest challenges are motivating employees to change their behavior and engaging employees in these programs that we just talked about that they're offering. Again, think back to that first slide. I'm developing a strategy. I'm not getting any input from employees on what they want to see or what they value in healthcare. I think, when we're working with employers, the more employee feedback you get, you might be able to achieve your results a little better. And, some things that we're seeing, I will comment on. One thing that you may want to consider is really trying to understand the different segments of your population. So we work with a lot of employers on kind of segmenting the population to understand how many Gen Xers you have, how many Gen Ys, how many millennials, because each of those different populations think differently about health. And the more that you can tailor your outreach and your incentives to those types of populations, the better engagement you can get in those types of programs.
Mitch, what are we seeing employers do to kind of help motivate this behavior change?
Yeah, some of the things that we're seeing, so there's two main fronts. The first front is financial. Can we come up with some financial incentives to get people to become more aware of the programs and then engage in the programs? Either we're giving them some reward for participating or maybe some penalty for not participating, but really trying to create some financial incentives to get them to take their screening and be more aware of their health. The other thing that we're doing and seeing is more communications and more education of employees. We know that a lot of our clients who are in this sector, many of their employees don't have access to computers, but a lot of them have cell phones, and most all of them have a smartphone. And we're seeing that, we're able to use text and different apps to get people more engaged with their health and greater access to health in these programs through some of the social media and some of the apps that are available through the new technologies.
Does it go as far as, starting to offer employees like kind of the wearable technology like the Fitbit and some of those types of products?
Yeah, a lot of our clients, even us, we have a lot of challenges where we offer discounts on the Fitbits, people wear them. I have a Garmin, don't tell anyone. But a lot of employers use the Fitbits to kind of track steps, do challenges, get teams together to kind of win challenges and improve health and try to do more of a social networking type of approach. But yeah, that's a perfect example of some of the things that our clients are doing. So back to the strategy thing. I set the strategy, I define my outcomes, I know what my challenges are going to be. What am I going to measure to make sure that I'm getting there? Well, when we ask employers that, a couple of things that are coming out. One, did I control my costs? Two, am I controlling my trend going forward? And then in the manufacturing sector, am I meeting my compliance requirements? So, that kind of ties out to what we said our objectives are going to be. But I think back to that first slide of why did we set the strategy? Part of it is to drive business results. Look at the bottom. I'm not tracking the impact on absence. I'm not tracking the impact on productivity. I'm not tracking organizational performance. Those are some of the things, emerging things that we're working on with some of our clients to help them find better ways to track how their health strategy is impacting absence and productivity and organizational performance and also organizational engagement. Another thing that we ask our clients throughout the survey is, what are your current desired approaches to healthcare? And you had a number of choices in this space. You could, one of the choices was, we're going to continue to manage our programs, we're going to offer a single carrier, and we're going to do incremental plan design changes. Another choice is, again, we're going to offer through a carrier or a third-party administrator, but instead of incremental plan design changes, and by that I mean deductible changes, co-insurance changes, maybe I'm going to do active management of employee health. That's where we get back to what we talked about, Brian. Some of these challenges, having fitness programs, having well-being programs, creating incentives to get people to really participate in these well-being activities. So, really an active management approach. And then another approach that we're seeing more of is this movement toward private exchanges.
What's a private exchange, Mitch?
So that's just this past week, many people may have seen that Starbucks has opted to go into Aon's private exchange. We have a private exchange. Our competitors have private exchanges. There's a lot of them out there. What a private exchange is really a marketplace. So I'll speak from experience with our exchange. What we do is we offer employers the choice of plans that they can put out in this marketplace, and sometimes, depending upon how big you are, a choice of carriers too. So Mrs. Santiago gets a credit from Aon Corporation every year to pick a health plan. She gets to go to our website. She decides what plan is best for our family, and we pick the high deductible health plan, and then which carrier is best. So she can use some tools to figure out which carrier has our kids' doctors in it, which hospitals do we go to, what's the best price from the different carriers for the plan that we want, and then she selects that carrier. So in this marketplace, kind of think of it almost as Amazon, where you as an employer give your employee a gift card. They get the gift card, they go to the website. In the website, they pick the plan that they want, and they pick the carriers that they want. And the website is designed to give them tools to help them make those decisions. That's what we're trying to do with the private exchange, is give employees a choice and help employers kind of contain their costs by coming up with this gift card approach, where we really set and define an employer's contribution so that no longer are they just paying whatever the cost of healthcare are. They're defining their contribution as, say, $8,000 for you, Brian, and then anything above that, Brian, you're going to pay the additional on. Anything less than that, depending upon how you structure it, either the employer can keep that, or you, Brian, can use that to buy your dental, your vision, additional life insurance, those sorts of things.
So from an employer standpoint, the exchanges can offer more cost-effective alternatives, as well as more choices for employees, which we would hope would translate into a higher level of engagement, higher employee satisfaction.
It's that, and then the other thing that we're trying to achieve with these is more innovation from the carriers. So when we're offering the carriers next to each other, they need to compete for your business. And what we're hoping is that through these exchange models and having open competition, the carriers become more innovative in the types of products that they offer, in the types of programs that they have in place with hospitals and the different networks that they have. So we're trying to really impact employers, employees on how they select healthcare, and then also the carrier community and how they innovate and bring new products to market. And when you look at the slide, you'll see that employers are starting to gravitate toward this approach. So right now, 2% of employers out there are saying, yeah, we're looking at a private exchange. Today, 62% of employers are saying, we're managing our healthcare through traditional management of deductibles, co-insurance, those types of things. In the future, over the next 3 to 5 years, we're expecting to see a shift. More employers realizing, look, I've pulled as many levers as I can on deductibles and co-insurance and co-payments. I really need to do something different. So many employers are saying, I'm going to maybe take an active role in managing the health and offering programs like we talked about earlier, like fitness challenges and rewards for people managing their health. Or I may say, you know what, maybe I'm not in the best position to be managing health. Maybe I'm going to give that to a third party and outsource that to a private exchange and let that private exchange do it. I'm just going to fund a certain amount of money for my employees to buy coverage through that exchange and let the exchange manage healthcare. And then we are seeing some employers, not many, but some employers really looking at the option of exiting in total and maybe having employees go to a public exchange. There's a cost to that. You know, you do face the Affordable Care Act penalties, but for some employers, that is an option that they're considering. When we think about exchanges, and back to why people might offer an exchange, in the manufacturing industry, what you've told us is, you know, if we're going to consider it, it really is for two main reasons. One is to offer more choice to our employees, like we talked about, Brian. The other is to, you know, really improve the predictability of our costs by going to that defined contribution approach on healthcare, where I'll give each employee X amount of dollars each year, maybe index that to maybe trend or CPI or something going forward in the future, and then working with the carriers to better manage healthcare costs going on into the future. But, you know, exchanges aren't the only thing that we're looking at. You know, we're seeing employers take on a number of different approaches over the next 3 to 5 years. And here on page 11, we're showing a number of different items. I'm not going to talk about all of them, but I'll point out a couple. You know, if you think about what employers are doing today, a lot of it is those first two items. You know, they're offering account-based plans, so high deductible health plans. That's something that 64% of employers do today. And many employers and more employers are offering them on a full replacement basis. You know, if you go down to second from the bottom, offering a high deductible plan as a full replacement, 15% of employers are doing that today. A couple of years ago, that was in single digits. So more employers really focusing on these high deductible health plans. So go back to what we believe in, holding people accountable. A lot of people are doing that through plan design, but then fully supporting them now with giving them some tools. The other thing that people are doing today is, you know, working on deductibles and co-pays like we talked about before. But some of the emerging things that we're doing, you know, when we think about it, part of it really is leveraging the supply chain. And if you think about that third item, you know, steering participants to higher quality hospitals and physicians, you know, one thing that we've seen in our research, Brian, is that high quality hospitals typically provide lower costs over time. So over a course of treatment, the higher quality hospital may have a higher rate on a, you know, per charge basis, but they're doing fewer charges. You know, there's not readmissions. They're treating the symptom correctly the first time. There's not a lot of retests. They're doing things right. And I think what we're working on with our clients is to move and steer participants using these higher quality providers through plan design and really leveraging the supply chain to make sure that we're getting the most efficient care that we possibly can. The other thing in this supply chain management type of thing is that last item, and adopting reference-based pricing. So one thing that you might notice out there on the phone is if you ever look at your claim reports, you might see, for example, on an MRI, you're going to see wide cost disparity on how much it costs to care it, even within a single marketplace. If you go to a freestanding MRI center versus a hospital, there's just this wide variation in cost. What some employers are saying is, look, that's great if you want the convenience of the hospital, but I'm only going to pay it maybe the 50th percentile of the cost of an MRI in a given marketplace. And if you want, if the convenience is important to you, that's great. I'm going to pay up to X, you can pay for the difference. If the convenience isn't important to you and you're willing to go, you know, drive a little bit further to a freestanding facility, or, you know, here in Chicago, we've got this place called Smart MRI, where every MRI is $500 all in. You go there, we're going to cover everything in full. And, you know, those are just some choices that employers are making. So I go back to hold people accountable, but now give them support. Give them information so that they know how to make the appropriate determinations. and really pay for care in the best way. And then I talked about earlier changing the way you pay, and I talked about steering the high-quality providers. One of the things that we're doing with our clients is helping them negotiate directly with these high-quality providers. So maybe get capitated rates or special discounts for steering my employees to these high-quality systems, get lower reimbursement rates.
Mitch, what about, you talked earlier about, one of the reasons for the increase in costs is pharmacy spend.
Yep.
Are there some things that employers are doing from a supply chain management perspective to try and kind of focus on that pharmacy spend? Is it becoming an increasingly larger challenge for them?
There are a couple of things that employers are doing, and again, I don't mean to have this come off as a commercial. We have a pharmacy coalition. Others do as well. There's plenty of pharmacy coalitions out there. I'll speak to ours. When clients join our pharmacy coalition, we've designed special programs to help our clients manage their specialty spend. So in our coalition, each client is given a dedicated pharmacist. And I think other coalitions do this as well, but the pharmacist watches the claims and helps the employer understand if there are special pharmacies that they could be going to get these specialty drugs. They'll also watch to see where drugs are being dispensed. Sometimes the specialty pharmacy drugs, you as an employer are better off having those run through your health plan because the hospitals may be getting those drugs at a lower cost and passing them on at a lower cost or in a physician office. If you're working with a pharmacist, they can point out to you which drugs are being dispensed at a specialty, and it helps you steer to the right places to get those drugs dispensed. Another thing that you can do, and this could be just working with your PBM, a number of the pharmaceutical manufacturers have programs in place to help low-income individuals afford these drugs. These are really expensive drugs, hundreds of thousands of dollars. Sometimes when these drugs pop up on the list and you notice it, you can work with your PBM to go work with that manufacturer to try to get it at a lower cost and get it into these coupon programs. So it's not necessarily going to help the employer, but it'll help your member. It'll help your employee, and that'll help improve their productivity, get their mind off some of the other things that are happening in a way to really help them focus back on their lives and get them back to a functioning state. In addition to those types of things, we're also seeing employers spend time really focusing on changing the way that they're subsidizing dependent care coverage. And so on page 12, there's a number of different tactics that we're seeing employers consider for the future, ranging from, and a lot of employers do this today, but requiring surcharges for adult dependents when they have coverage elsewhere. Maybe it's $100 a month or $50 a month extra if your spouse does have access to other coverage. We see a lot of employers reducing subsidies for dependents across the board. And in the appendix in this document, there's a slide that kind of points that out for you. Some employers are taking a look at eliminating coverage for adult dependents when they have access, and not just charging an additional $50, but saying, no, you're not eligible for my plan if you have coverage through another employer. And then another tactic that we're seeing, and our actuaries are pricing out a lot of, is this approach called unitized pricing. So instead of having just a single and a family rate, or maybe a single and a dependent plus one, we're really charging for each dependent that's on the plan. So I've got 3 kids. So today I'm getting a good deal. Most families here are priced down at 3 or 4 members. I got 5. If we adopted a unitized pricing method, I'd see increased costs because we'd be charging more for each of the dependents I cover on the plan. Something that our actuaries are pricing a lot out of. And then also, something that's been in existence for a while is offering incentives for people to opt out of coverage. There's some new regulations around those opt-out credits that if you're offering those today, take a look at how you've created those, because there are some new compliance requirements that you have to take a look at relative to the Affordable Care Act and whether or not healthcare is affordable when you're offering these opt-out credits. So just something to keep in mind. You know, the final thing we'll spend some time talking about here is the excise tax. So for those of you who aren't familiar with it, the Affordable Care Act has a clause in it, or was initially had a clause in it that was to take effect in 2018. And what that clause said was, if you, as an employer, offer a very rich plan, sometimes this is referred to as the Cadillac tax, a very rich plan design, we're going to penalize you for that. So if you offered a plan that cost more than $10,200 for a single or $27,500 for a family, I'm going to tax you, the employer, 40% on the amount above those limits. In our survey, we asked fortunately for employers, the effective date of that law has been kicked back from 2018 to 2020. We'll see what happens. I mean, a lot of people don't like this law. There's been talk of either modifying it or repealing it, but assuming it stays in place, we asked employers in the survey, when is this going to kick in for you? And the vast majority of employers said it's either going to hit us immediately once it becomes effective, or within the next 2 to 3 years of this becoming effective. And when we run reports for our clients, we're seeing that as well. That, you know, there's no avoiding this tax. At some point, you're going to pay it. What we're showing on page 13 are ideas that employers are coming up with to help avoid paying that tax, or at least deferring it as long as possible. And I won't walk through all of these, but you'll see that there's a number of different things that employers are going to do to try to manipulate their plan designs and their contributions to try to avoid that cost as much as possible. And, you know, doing everything from adopting other cost control strategies to increasing out-of-pockets, doing whatever it takes. One thing that I'll warn this group, you know, my guess is because of the industries that you're in, many of you may have bargaining contracts and unions. Check your union negotiation or your bargaining agreements. You want to make sure that as you bargain in the future, you're giving yourself some flexibility to address the excise tax once it becomes effective. I've seen many clients who have union contracts with very high cost plans that don't have any wiggle room for them to do anything other than just pay the tax once it becomes effective. You need some leverage in there to have some flexibility so that you control those costs once the tax becomes effective. You know, so those were the main findings from our survey. I hope that you found this useful. I've left the contact information for Brian and myself on the thank you page. But would, you know, happy to open it up to questions for our remaining time to see if there are things that people want to talk about or have questions about what we presented. And if you don't have any questions, that's fine. Feel free to submit them. While we wait a minute, I will point out that there is an appendix to this document, and I think you're going to send it out and share it with the members. In the appendix, we do have a couple of additional pages of information that may or may not be useful for you. One of them just kind of gives you some information about employee cost-sharing amounts and what we're seeing today. And the other is we asked employers, are you looking at taking any of your lines of coverage out to bid in the coming years? And on page 17, we just show people what lines are being considered.
Okay, well, thank you so much. And again, if you have any questions at all, feel free to contact Ann directly, or you can contact me at MSCI, and we hope to see you at our next webinar. Thank you.
Thank you very much.
Thank you.